It does seem like every day I get another call from a journalist, usually a journalist who is trying to get information that they can't get. And Phil, what I'm seeing is there's a divide, especially between rural counties and urban counties. And that urban counties, you're getting more information. The hospitals are releasing more information. The health departments are releasing more information. But what I'm starting to see now is a lot of complaints. When I say rural, I mean, I'm speaking loosely like suburban counties that can't get the same kind of information like the demographic information or the recovery rate or even like the zip code or part of the town. You're not seeing those heat maps in other places.
So what is your message to those who are having trouble getting information?
Well, I think they have to keep trying and applying pressure for it and keep explaining why this is in the interest of public safety and public health. People need information to know what to do and to keep themselves safe and to keep their loved ones safe. And this is unlike anything we've faced in that it's really on us. It's really on the public to take steps. The state's not doing everything. It's really on us, and we cannot act unless we have information. So that information flow is very important to people's understanding of the coronavirus and to people's ability to take action.
So, for example, in this case, we know which nursing homes have at least 2 COVID-19 cases, and that's all we know. What is your reaction to that amount of information?
Well, the state probably doesn't look at it this way, but by withholding infection rates and death rates, they're basically hiding what's going on in nursing homes and assisted living centers and those kind of facilities. And, that breaks my heart. These are the most vulnerable people in our state. And to hide what's going on is a real disservice both to the families and to the public. We need to understand what's going on in the nursing homes and assisted living centers. And the state appears to have taken a position that everything is okay as long as we know, as long as the nursing home knows, it'll all be okay. And I think that that's not true. I think that they do need to share that information. People need to understand what's going on there. We have seen this with the state. In the very beginning, they were refusing to release the infection rates by county. And then there was a lot of public pressure on that. And within days, they started releasing the information by county. Then the next big thing that there were complaints about were issuing the number of deaths per county. And again, that one took a little longer, but there was outcry from the public who wanted to know what was happening in their counties, and they started releasing that. I believe that the nursing home data, they weren't releasing anything about where infection rates were, and there was some pressure on that. And now they're at least saying there is an infection in this nursing home.
So what does that say about how the state is developing its disclosure policies, transparency policies?
Well, I think they're going off old protocols and old understandings about privacy of individuals. And in the case of nursing homes, maybe they think that the nursing home has some privacy concern. And you do see the state sort of recognizing slowly that no, this is information that's in the public interest. So, I'm not sure why it's taken a while. Other states have generally been more out front than Tennessee in getting information to its citizens about, infections, death rates, age of victims, all of these kinds of things. And, that's important in this time because it increases our understanding. Listen, the enemy is COVID-19. And it is all hands on deck for the public to understand as much as they can what's going on. And for the state to be kind of slow and halting and releasing that is a little bit disappointing. I understand that they don't see it that way. They see probably themselves as being very cautious in terms of identifying individuals.
Yeah, and that's based on our conversation last night, it occurred to me, I think I just need to submit a public records request because the reasoning isn't always articulated as to why they're withholding information.
Correct. And I think that's one of the problems we've had. It's been sort of a vague explanation as to why they're withholding. Sometimes it is, well, we don't want to identify the person who has COVID-19. Well, it doesn't really hold up when you have 5,000 people in the very smallest county and saying that there's a case there is going to identify the person. I think the same is true with the nursing homes. I don't know why they're not releasing the data in the nursing homes. If I had to guess, it would be that they're concerned about maybe the reputation of the nursing home. And, you know, I get that, but at the same time, maybe this is a time when the reputation of the nursing home is less important than the importance of the public knowing what's going on in nursing homes. Do we have a huge problem? I mean, we just learned that I learned yesterday, a WPLN story, that 19 people so far, this was as of yesterday, had died from that in that Gallatin nursing home. Well, wow, that's a large number. And the public needs to understand what's going on in those facilities so that they can support and advocate and for relief. I mean, by hiding that story, we don't really have a good sense of where it's a problem and how bad a problem it is.